everyone, and welcome to CCA's Medical Minute Podcast. I'm Sherry Hughes, and this is our 65th episode of Medical Minute. And wow, we are glad to be here. We're sponsored by Kroger Health, where Kroger Health, a world of care, is in store. Today with us in store, you're in store for something good, is Dr. David O. He is the Chief Medical Officer with UC's Hawksworth Blood Center. Welcome, Dr. O.
Thank you, Sherry. Thanks. I'm really pleased to be here.
It's good to have you. I was just saying earlier, I say your name in some form or fashion. It's such a cool name. I say O all day long, but you're Dr. O, and you know all things right now blood because you head up the blood center. And one of the things that we were interested in talking about on this podcast is how necessary blood donations are for cancer patients, and not only cancer patients, but people at large. And right now there's a national shortage, right?
Yeah, so there is, this has been a really rough summer in terms of blood collection. Some blood areas are better than others, right, in terms of collection. And so we've actually been very fortunate here at Cincinnati area and with Hawksworth Blood Center to have such a great donor base where our shortages have been much more limited than they are in the rest of the country.
But, I know the importance of folks that donate blood because there are many that receive it, the recipients. In fact, I was telling you earlier that as a breast cancer survivor myself, I never needed an actual transfusion, but my mom, who went through breast cancer, used to get an infusion pretty often. So that lends me to ask the question, are cancer patients able to donate blood at any point in time?
Sure. It's a great question. So after people have had their cancer resolved, so we always hope for that outcome, we ask them to wait a year before they come and donate again. But then they are able to come and donate. So these would be solid organ cancers. People with superficial skin cancers, as soon as those are removed, they're able to donate. But people with bone marrow and lymphatic or blood-related cancers are not going to come and donate again for us.
Okay, so I imagine you should always check with your physician and make sure that they kind of give you the check off on it.
Yeah, so it's interesting. So we've found through all the years of transfusion that cancer is not transfusion transmitted. So we're not so worried about the recipients receiving the products. We really want to make sure that people are recovered from their cancer and will be, not having to undergo treatment.
Because that's the thing in the first place that tends to lower, right? Blood counts and platelets and things of that nature.
Yeah, exactly. And so oftentimes it's not the cancer directly, but it's the medications that people are taking where it will affect blood production. And so we don't want to take blood from people if, they're not really resolved with their cancer. So usually 12 months is what we're asking people to wait.
Exactly. So what should blood donors know about donating blood? Oftentimes the people that haven't gone in to donate, they have all these misconceptions about what donating their blood will do. And oftentimes people who are recipients of blood often feel like, I don't know if I want to receive the blood because they're not sure if it's okay. But that's not the case. It's very safe.
So a couple of different sides of that, right? So donating blood first, it's a pretty simple process, right? There's some folks who are, if they're really small, in volume, so we ask people to be at least 110 pounds before they come out and donate, because less than that, it's a lot of blood volume lost for them. Greater than that, people typically are able to tolerate removal of about half a liter of blood, or 500 milliliters. We ask people to eat decent, not overstuff, not go to the all-you-can-eat buffet beforehand, but not to skip breakfast, before you come and donate. So have a decent breakfast. Make sure you hydrate well, and then we'll do a series of little examinations for you. We'll look at blood pressure. We'll look at your blood levels.
So they're actually getting checked out before
There's
they donate.
There's a little bit of a checkup. Yeah. I kind of say it's not. You should go see your doctor still, but we'll check the blood pressure. We'll check the heart rate and make sure that everything is within parameters. We'll ask about weight, and then if you qualify, then we'll go ahead and then collect you. So there's a little bit of an evaluation that goes on.
Yeah, Dr. O, you were saying that this region is doing pretty good.
Yeah.
Within this region, we have a lot of the different healthcare systems.
Yeah.
How much of that blood is actually going to cancer patients? I know that's kind of hard to pinpoint exactly.
So that's why I brought my little book with me today. So I've got so about 25% of the blood that's transfused goes to cancer patients. So quite a bit. especially in our area here, our platelets will go to Children's Hospital for kids who have blood cancers.
Okay.
And so it's quite a few people who have cancer who will need blood products.
That's a large percentage, 25% of your donor base giving blood, giving life, so to speak, to those that are diagnosed with cancer. And so I think that's why it's so important that we kind of reiterate and constantly keep telling people that we need those donors.
Yeah. So again, of the percentage of people who are eligible to donate, which is, less than half, only about 3% of people in the general population come out and donate. And they're supporting everybody who needs it. So we need more people to come out and be able to donate. The thing that, we have promotions all the time, right? A little tumbler, a blanket or something with our logo on it that we give out to people. But really what we want people to do when they give is to leave after donating with the sense that they help somebody and that they help somebody in the community.
Yeah, I donated frequently prior to my cancer.
Oh, did you? Okay, great.
My cancer diagnosis, and now that's something I'm looking into, hopefully being able to get cleared out so that I can give again. Recipient-wise or donor-wise, who is eligible to donate blood?
Yeah, so some 16-year-olds are able. That's the youngest that you can do. We actually ask for parental consent at that point, but most states have a law where people 17 and above are able to donate. And then we don't have a strict upper cutoff because health is so variable, right, for people as they get older. So some folks are able to donate quite, at quite an older age. But as our population ages, we're finding that many of our solid blood donors who have come in for years and years and years are starting to get diagnosed with cancer or with other things and just not able to continue to donate. So we need fresh blood, as we call it, fresh blood to kind of come in and donate.
Yeah, definitely. And hopefully we're encouraging people who are watching the podcast today to go out and donate because, as you said, it's kind of a cyclical or cycle thing. You never really know when you might be that person that's in need.
Yeah, so it's giving it forward, right, is kind of one of the terms that people are using. While they're able to, they can go ahead and donate and hope somebody else in the community will donate when their time comes.
When their need comes. For those that are already donating blood, is there like a limit to what you can give and how often you can give it?
If you want to give a ton of blood and you want to come in every 2 weeks, we have platelet donation. And so we really look for people blood types A, B, and A as ideal platelet donors, but somebody who's an O who wants to make that commitment and come in every 2 weeks, 24 times a year, they can donate platelets with us. So that's the number one frequency. If you donate whole blood, which is the typical donation for us, and that often is our mobiles that go out to, and so if you're donating a blood drive where you see a bus or they come out to your workplace, you can donate once every 8 weeks for that.
Do you need to know your blood type, or will you find out?
We'll tell you. Yeah, no, we'll find out and we'll tell you. So a lot of people do donate and they're really curious, what their blood type is. So yeah, you come out, donate, we'll send you a letter and we'll tell you what your blood type is.
As we're wrapping this up, what is one of the number one reasons why those that are diagnosed with cancer would find themselves needing blood transfusions?
Yeah, so oftentimes the medications that people are taking will inhibit your blood production. Sometimes cancers can affect your bone marrow as well and your production ability. So you're not able to produce those cells that you need on your own. Yeah,
and in this community, I believe there's somewhat 11.5% percent of the population, at least I would say more than 11,000 people that are diagnosed every year with some form of cancer. Blood donations are really important, very critical.
Yeah. I'll say we changed that policy in terms of cancer survivors who can come back to 12 months. It used to be for breast cancer that it was a permanent deferral. And so probably about 3 years ago, I would say, after I came here about 5 years ago, we changed that. So that it's now 12 months. And so a lot of people were really kind of mad at us because we had that long period of deferral. So now if you had been deferred before and you're recovered from your cancer survivor, contact us. We go to hawksworth.org. So I can never remember the times and locations that we have, but go to hawksworth.org. You'll find all the information you need and you can go ahead and schedule an appointment. If you're currently deferred, you will have to kind of get that removed before you show up for us. But if you've never been deferred formally and you've recovered from cancer, come ahead and
Very good.
donate.
Dr. O. And don't forget, Dr. O has a podcast too. It's called In the Know with Dr. O
That's
on
correct.
iHeart, right?
On iHeartMedia, yeah. In the Know with Dr. O, yeah.
Okay. Well, listen, thank you so much for coming in with us and sharing with our audience. And we certainly hope that you guys will go out and donate blood because, as Dr. O said, you never know when you might be in need. And we will see you again on our next podcast coming up here soon, but make sure that you share and also subscribe. Thank you, and we'll see you next time.